Breast cancer is the most frequent oncological disease in the female gender worldwide and in all age groups, particularly in women over 50 and with a family or personal history of breast cancer. According to data from the Italian Association of Cancer Registries in Italy in 2021, around 55,500 new diagnoses of breast cancer were estimated, of which 55,000 in women and 500 in men. Overall, it emerges that in Italy, 1 in 8 women and 1 in 565 men will develop breast cancer in their lifetime. However, thanks to the continuous progress of medicine and screening for early diagnosis, less people die of breast cancer than in the past, with a 5-year survival from diagnosis of 87%, about 9 out of 10 women, and 84% in gender male, about 8 out of 10 men. In this video, we will talk exclusively about breast cancer in the female gender, which represents the leading cause of death from cancer in women. In the last video, however, which you can find by clicking above, we will see what the symptoms of prostate cancer are, malignant neoplasm most diagnosed in the male population. Anatomy of breast. The breasts are glandular organs located in the anterior region of the chest, between the 3rd and 7th ribs, and are made up of adipose tissue, glandular tissue, and support tissue. The glandular part of each breast is formed by about 15 to 20 lobes, each divided into mammary lobules, from which the mother's milk leaves and reaches the nipple through the milk ducts. The lobules are in turn composed of groups of glandular tissue called mammary alveoli and represent the site of production and storage of milk in the mammary gland. Throughout life, the breast is subject to a series of changes in shape and volume. Among the main culprits, we find the hormonal changes that occur in the woman's body during puberty, the menstrual cycle, pregnancy, childbirth, and menopause. Types of breast cancer. However, when some cells of the breast tissue begin to grow abnormally and uncontrollably, a mass is formed that can give rise to breast cancer. We talk about ductal carcinoma when it develops from the cells of the lactiferous ducts. It is the most common breast cancer, and it represents between 70% and 80% of all forms of breast cancer. In 10 to 15% of cases, however, the carcinoma develops from the breast lobules, and in this case, we speak of lobular carcinoma. What are the symptoms of breast cancer? The Italian Association for Cancer Research recalls that the initial forms of breast cancer generally do not cause pain, and the symptoms can vary depending on the specific type of breast cancer. Let's see which ones are the most common. Breast lump. The breast tissue is greatly influenced by hormonal changes and can react by causing the formation of breast lumps, that is, small round or irregular masses that can be of physiological or pathological origin. The lump looks like a thickening or bump that feels different to the touch from the surrounding breast tissue. Most breast lumps are cysts or benign tumors, but in some cases, they can be a sign of a malignant tumor. In this case, it usually manifests itself as a hard, irregularly shaped, painless lump and adherent to the underlying tissue. If it is not detected and treated early, the tumor begins to grow and invade the surrounding breast tissue and then spread to nearby lymph nodes and eventually to other organs in the body. It's here that an important prevention tool comes into play: breast self-exam. It is a simple exam that every woman can carry out in the comfort of her own home and allows to examine the appearance and structure of the breast in order to identify the presence of any lumps, alterations of breast tissue changes, and changes in the appearance of the nipples and breast areola. Changes in skin of the breast. When we talk about orange peel skin, most people will immediately think of the typical effect of cellulite, a disorder that affects about 80–90% of the world's female population. Even the skin that covers the breast can take on an orange peel appearance due to those lymphatic edematous processes, which not functioning correctly cause lymphatic stagnation. This could be a sign of breast cancer, where cancer cells block the lymphatic vessels under the skin of the breast, making it look thick and wrinkled, similar to that of the peel of an orange. Mammary areola alterations. The areola is the part of the female breast that surrounds the nipple and is located in the center of each breast. It has an oval or circular shape, and its particular color varies according to the concentration of two particular pigments in that area, namely eumelanin and pheomelanin. The first determines a more brownish color, while the second more reddish or rosacea. The breast areola can change color as a result of hormonal changes, such as during the menstrual cycle and pregnancy, but also following the intake of certain drugs or as a reaction to cold. A suspicious change in the color of the areola could be a symptom of Paget's disease of the nipple. It is a rare form of malignancy that arises from the epidermal extension of an underlying ductal mammary carcinoma as the cancerous cells spread from the lactiferous ducts to the nipple and areola. These last two areas take on an eczema-like appearance, making the skin dry, red, and itchy. It generally affects only one breast, and in some cases, it can cause the introversion of the nipple, which instead of protruding outwards is retracted inside the breast. Abnormal nipple discharge. Nipple discharge is a disorder in which liquid material leaks from the nipple in women who are neither pregnant nor breastfeeding. If the leaked liquid has a consistency and color similar to milk, we speak of non-puerperal galactorrhoea, and as the name suggests, it occurs outside the physiological context of childbirth and therefore of breastfeeding. Among the main causes, we find an infection or abscess of the breast, the use of certain drugs or birth control pills, endocrine disorders, a tumor of the pituitary gland or of the breast. Serous or bloody discharge from the nipple is undoubtedly a great concern and warrants medical attention, particularly if the discharge is from only one nipple. However, according to statistics, only in 10% of cases breast cancer causes nipple secretions, and most of these women also have other symptoms, such as the presence of a lump in the breast or changes in the shape of the nipple. Enlarged axillary lymph nodes. The lymphatic glands, also known as lymph nodes, are small bean-shaped glands that have the task of filtering the lymph they receive from the lymphatic vessels to remove any foreign substances, germs, or neoplastic cells. Not only that, they also perform a very important immune function, as they host part of the B and T lymphocytes. The axillary lymph nodes, estimated to number 15 to 35, filter the lymph coming from the upper limbs, part of the chest, and the upper part of the abdomen. When lymph nodes swell, it is most often the result of an infectious, inflammatory, or autoimmune disease. In a lower percentage of cases, however, their enlargement could be the first sign of the onset of breast cancer or the signal that it is spreading. Lymph nodes are therefore very important in the diagnosis of cancer. If you notice swelling that persists for a few weeks or tends to increase over time, you should contact your doctor as soon as possible. Final considerations. The symptoms we just discussed do not necessarily mean that you have breast cancer or another serious disease. Often, they are simply due to some condition of a benign nature. Any symptom, in this case involving the breast, must always be reported to your doctor in order to undergo all the tests necessary to exclude the possible presence of a malignant neoplasm. We also remember that prevention is the best weapon we have in our hands to diagnose a tumor early when it is still in its initial stages, thus improving the effectiveness of the therapies and therefore the chances of recovery. What breast cancer prevention consists of, however, we will see better in a next video.